Welcome to Pajan Imaging Hub. In today's patient and public education series, we look at heart failure, how the diagnosis is made using chest X-ray. Please like and subscribe to the channel to be notified when new video is released. Welcome back. What is heart failure? How do the radiologist or radiographer make this diagnosis? When you go to radiology department to do X-ray, maybe you have some complaint to your doctor, he send you to radiology department, and if they make diagnosis of heart failure, what do they look at to make this diagnosis? How do they do that? Heart failure is inability of the heart to pump out blood or to receive blood back sufficiently to meet body's blood flow need. So if the heart could not pump out blood sufficiently to the body parts or receive blood sufficiently from the body parts, then we say the patient has heart failure. Heart failure can also be called other names. Yeah, we can call it congestive cardiac failure, CCF, congestive heart failure, CHF. In your report, you may see these other names of heart failure. They are the same. Heart failure could be caused by structural or functional anomaly, and it can also be inherited or acquired. Inherited means that it can be passed to the children from their parents. This means that heart failure can be caused by defects in the structures of the heart or its vessels. The heart is made up of structures, so the defect in these structures can cause heart failure. It can also be defect in its function, like triggering of the heart to beat, which will lead to pumping of the blood. If those mechanisms are faulty, it can lead to heart failure. There are signs of heart failure, and they include fatigue, syncope. Syncope means fainting or passing out, that is temporary loss of consciousness. And dyspnea, which is difficulty in breathing. Then the patient can have a subjective discomfort, a situation where only them can explain to you the kind of discomfort they're having. Patient have nocturia, passing of urine in the night, much urine. Then pitting edema is a situation of swelling in the leg or feet area, and pressing the skin in this area leaves a temporary indentation or pit. Yeah, it presses in and it takes a little then before it rises again, those area of skin. They have jugular venous distension and hepatomegaly. The liver become bigger. These are the signs we see in a patient with heart failure. It will surprise you to know that 20 million people suffer heart failure worldwide. So it's a serious issue. Plain X-ray, which we do in radiology department, has about 70% accuracy in diagnosis of CCF. This is a structure of the heart. And see, this colored blue part is the part that receives blood to the heart. The red colored part is the part that takes blood away, that pumps blood to the parts of the body away from the heart. So the blue part receives blood from the parts of the body back to the heart. So if any of these two are not working well, that they are not receiving sufficient blood back to the heart or pumping sufficient blood out of the heart to the body parts, then the patient is said to have heart failure. And you see this other structure here. This is inside of the heart. You see, when we talk about it could be a structural defect. These are structures in the heart. These are valves, these things. So if they are faulty, then it can lead to heart failure. This is a chest X-ray. So this is the heart. And this in here is a fluid. We'll look at it in a moment. Then this is the lungs area. You see this fluid is occupying part of the lung of this right lung. This is a case of heart failure. So let's look at what the radiographer or radiologist finds in a chest X-ray that has a case of heart failure. There are four things they look out for. They look out for signs of these four things in the chest X-ray. They look out for pulmonary venous congestion. That is signs of pulmonary venous congestion, signs of cardiomegaly, signs of pulmonary edema, and signs of pleural effusion. This thing here is pleural effusion. So it's fluid that occupies these parts of the lung. So we'll see that is how it looks like. That is a sign of pleural effusion. Then we'll look at the first one, signs of pulmonary venous congestion. When there is much blood in the heart and vessels, blood pressure will increase, and this will cause some of the fluid to flow out of the blood vessels to the spaces inside the lung. This will tend to occupy the lower portion. These areas to tend to occupy the lower portion of the chest, and this makes it difficult for blood to flow to the lower portion. So once this fluid that is coming out of the blood vessels occupy the lower portions, it will make it difficult for blood to flow easily through these vessels here. The vessels here will become smaller in size. Now, this will cause diversion or redistribution of blood to the upper parts. The signs that we see now that help us to know that this have occurred is that the vessels in this upper part, see these vessels, will become bigger than the vessels in the lower parts. So that will show you that there is a redistribution of blood. That is a sign of pulmonary venous congestion. So these the signs they look out for to say that this person have a heart failure. Then let's look at other images. This case is a cardiomegaly. See, the heart is big. See how big the heart is. It's very big. So that is cardiomegaly. So it's a sign of cardiomegaly. Then we'll look at the signs of pulmonary edema. Pulmonary edema, there are signs we see to say that a patient has a pulmonary edema. One is that the lungs area, these areas will not be clear. You'll be seeing opacities, as you can see in these two images. You see opacities that cover them. Then you see this area. Let's look at this other image so you understand what I want to show you. This area is called the hilum. Is the right hilum, the left hilum. Now this area is more like where the septals or the spaces of the lungs, they have a kind of alignment to this area. So whenever there is pulmonary edema, because we're looking to see how they determine the signs that make them to make the diagnosis. So when these areas are pointed out to you, become enlarged, as you can see in this image, then is a sign of pulmonary edema. Now let's look at what the sign of pulmonary edema look like. Now one of the signs is that the vessels will become indistinct. They will appear blood as if they have hairs around them. So they will become indistinct. You see these vessels, you see they are not distinct. They appear as if there are hairs. See all these opacities. They appear as if there are hairs around them. So that is a sign of pulmonary edema, one of the signs. Then the hilum will be enlarged. You see this one is enlarged. This is equally enlarged. But though you're going to see a bigger one soon. You see this area. The hilum here is enlarged. You see how big it is. You see this area. So it looks like a wing of bat. So we'll call it bat wing sign. Also this one too. You see how it looks like bat wing too. And so it's enlarged. is a sign of pulmonary edema. You see how the inside of the lung look hazy. This other image, you see fluid, see fluid. This fluid is a sign of pleural effusion. We cannot even make out the heart. Then you see this thickening of the fissure, or call it horizontal fissure. It's thickening, so you see it appears thickening. Normally in X-rays you barely see it, but once it's thickening, it becomes visible. It's also a sign of pulmonary edema. In this image, you see also the thickening, enlargement of the hilum. Then you see that inside this, you see small, tiny uh, and light and the lines uh, passing linearly inside, and also tiny round also. These are the signs of pulmonary edema. These are the things they look out for when you do chest X-ray to say that you have pulmonary edema. Then, but I would like to tell you that the the diagnosis we made in the radiology department. Remember, it is the doctor that sent you to do the investigation. So it is expected that it's the doctor that will make the final diagnosis. When he or she must have combined the different test results that he has sent you to do, he will now know what is the final diagnosis. Thank you. Please like, share, and subscribe to this channel for more videos. Bye for now.